March is National Colorectal Cancer Awareness Month, and we're learning more about what might put somebody at higher risk and what to do with those risks. And joining us is Dr. Alan Thorson, a retired colorectal cancer surgeon and board president of the Nebraska Cancer Coalition. Dr. Thorson, tell us a little bit more about what might put somebody at higher risk for CRC.
Sure. I think that's important for people to understand that. First of all, family history is probably the most important and the highest risk factor for developing colorectal cancer. We know that if you have a first degree relative, that would be like a parent or a brother or sister, or an offspring, a child that has colorectal cancer, that puts you at increased risk. Other factors that can increase your risk are lack of some dietary things, not eating a lot of fiber in your diet, um, perhaps not having enough physical activity. People who have are more of a sedentary lifestyle are at higher risk for developing a colorectal cancer. Excess alcohol use has been associated with it. Diabetic patients have an increased risk. As far as other risk factors that we don't have any control over, if you have a history of inflammatory bowel disease, and that would be either ulcerative colitis or Crohn's disease, they both increase your risk for developing a colorectal cancer. So those are probably the main things we could talk about.
All of these, of course, impact our screening options. We know that colonoscopies are not the only screening option, but it sounds like it is the gold standard. But how do all of those impact our screening options?
So if you have an increased risk, then probably colonoscopy becomes a preferred method in those situations. We know that there are a number of different tests available, which is really important for people to understand. We have the at-home tests, which are stool tests. They can check for either blood in the stool or for DNA in the stool, or a combination of both. And those tests are nice because they can be done at home. They don't require any preparation of the bowel. In other words, you don't have to clean your bowel out. You don't take that big prep that people are concerned about. It's more economical from the standpoint it doesn't cost very much up front. Uh, and you don't have to take time off from work like you would for a colonoscopy. However, if you're doing stool tests, most of those you have to do every year, or you won't have the same positive impact on decreasing your risk from colorectal cancer. So it becomes an annual test. And those tests are best at finding cancers at an early stage. They can find some polyps being the precancerous condition that can lead to colon cancer. So the stool tests can find some polyps, but primarily they're about early detection. We know that early detection is important because cancers detected early become much more treatable and survivable. Colonoscopy, on the other hand, it does take some prep. It does usually take some time off from work. It does actually is more of a preventative measure because it can find polyps, which are those precursors or the forerunning of cancer. So it's a bit more accurate, particularly in those patients who have a higher risk. It's better at finding those polyps that we're looking for and other abnormalities. The thing about colonoscopy, the other thing, of course, is for the standard person, it only needs to be done once every 10 years. However, if you have increased risk, you probably will find that you need to have it done a little bit more frequently, maybe every 5 years, maybe every 3 years. In some instances, like inflammatory bowel disease, every year. So those are just issues that need to be addressed so people can talk with their doctor about what might be the best test for them, given their family history and what their needs are.
Dr. Thorson, you, of course, have extensive, what's the word I'm looking for? Um, Experience. You have extensive experience in this industry, serving as, board president of the Nebraska Cancer Coalition and a retired colorectal cancer surgeon. What else is important to mention about this topic that we haven't had the opportunity to touch on?
Well, right now, of course, we're focusing on this new recommendation to start screening at age 45, which is critical to understand because we know that more and more younger people are developing colorectal cancer than what we have had in the past. So 45 is the new 50, as we're saying. That's kind of our trademark comment now. 45 is the new 50 for colorectal cancer screening, um, which is probably one of the most important items we're trying to get past or get through to help people understand at the present time.
Absolutely. A wealth of information. Dr. Thorson, thanks so much for joining us.
Thank you very much for the opportunity to talk.